name is Benjamin Binagwa. I'm the Chief of Party for the PMI Uganda Malaria Reduction Activity. This is a 5-year activity that started in February 2022. It's a 5-year program funded by USAID and focusing primarily on supporting the government of Uganda on malaria-related interventions, with a focus on contributing to the national goal of reducing malaria morbidity by 50% and death related to malaria by 75% by the year 2025. We are a consortium of partners led by JSI and with 4 other partners who are supporting the different technical components of the activity. The Child Health and Development Center of Makerere University is one of the consortium partners on this particular activity. And we tap into the competencies and experiences of Child Health and Development Center in different areas. We do appreciate the role the Child Health and Development Center has done in social research, but we also value the efforts of the Child Health and Development Center that have been geared towards improving health systems for better case management at different levels of the healthcare delivery system. For this particular activity, the Child Health and Development Center is taking lead in 2 main areas. One is helping to generate evidence at community level through social research that helps us to develop strategic interventions that facilitate behavior change at the household level. In other words, the Child Health and Development Center is critical in terms of generating evidence that helps us to determine priorities that need to be included in our strategic interventions, especially for behavior change related interventions. Secondly, in terms of community level work, they also help us to track the evidence of our interventions as to whether the interventions that are being implemented as a result of the priorities that we identify are giving us the results that we expect. So that's one major component that the Child Health and Development Center helps us on this project. The second element, it being a Child Health and Development Center of a tertiary institution like Makerere University, the experience they have in healthcare delivery is enormous, and we are tapping this experience to help us in the improvement of service delivery at both public and private health facilities. What they have done as an initial startup for this activity is to help us carry out an assessment of the performance of the different health facilities in the areas where we are working, to identify gaps that then would give us the opportunity to identify priorities of intervention to improve case management, referral, and linkage between the communities and the health facilities. Help us to generate information from the health facilities, both private and public, that would then help us determine gaps in terms of the capacity, the skills, the knowledge of the health workers, but also the tools and other commodities that are required for the health workers to perform the work that they are supposed to perform in order to improve case management. As a result of this assessment, we identified quite significant areas related to the health workers themselves, but also those areas within the facilities that would help the health workers to perform to their best. And therefore, following that assessment, Child Health and Development Center, working together with the rest of the teams here, helped us to generate a strategy that would help us, one, intervene in terms of supporting the health workers to be able to do their work through mentorship, through training, on-site mentorship, but also helping the health workers to be able to capture the data that would then inform other actions related to service delivery. The second element, in terms of how we use that assessment report, is to look at what else is required at the health facilities to enable the health workers perform to their utmost. And some of these are related to commodities, for example, malaria-related commodities, management of commodities, stock taking, making sure that we look at the expiry dates and we utilize the first in, first expiry model, and making sure that the health workers themselves are comfortable within the environment in which they are working. Moving forward, we have agreed and tasked the Child Health and Development Center to take lead in supporting mentorships and any related trainings in the private for-profit facilities, including drug shops, that would help improve case management for malaria, would improve timely referral, but also making sure that the private for-profit facilities do report accurately. The fact that we have only been relying on data in the health management information system, which to some extent some of the private facilities don't contribute to, this does not give us the actual picture of the situation of malaria at community, at sub-county, and even district level. Therefore, some of the data that we have in DHIS2 at national level lacks some of the information that is supposed to be generated by the private for-profit. And therefore, PMI MRA, with the support of the Child Health and Development Center, tapping into their vast experience, is helping us to focus on that area so that our contribution can be significant in terms of improving malaria case management in private for-profit facilities. So we take pride in being in a Child Health and Development Center being part of us, because we are tapping this big resource in those two areas that I have articulated. One is the community component, addressing the community level issues, including behavioral economics. And this, for me, brings in a different dynamic in terms of how we manage our SBC interventions. We know for sure that the economy is a big contributor to how people make decisions and where they go for treatment. And therefore, us understanding these dynamics would certainly help us in improving our strategic focus and implementation modalities.